Everybody, this is a quick video over polygraph tests and physiological responses for the beginning of 1.1.2 Reliable Witnesses. So in this activity, you're going to get introduced to 5 persons of interest in the Ana Garcia case, and you're going to get a chance to evaluate their polygraph data from interviews that they had with law enforcement officers investigating this case to try to determine if any of them might be lying in their responses. So we don't know a lot about the case yet with Ana Garcia, but if there is foul play, these 5 people had a close relationship with Ana, and they were therefore more likely to have been involved. And so those 5 people are first Eric Piedmont. Eric Piedmont is Ana's boyfriend. He's 20 years old, and friends noted that Ana and Eric were recently seen arguing. Dominic Hall is Ana's classmate. They're kind of like friendly rivals. They're in classes together, but they kind of compete with each other quite a bit. Taylor Diaz, 19 years old, Ana's friend who actually found her in the lab. He works with Ana in the lab. He's the one who actually called police. Dr. Opal, it is her lab that Ana works in. She is Ana's advisor and recently declined to write a recommendation letter for her. And then finally, Sam Green, Ana's soccer teammate. They do not get along very well. They really don't seem to like each other, and they've been seen fighting recently and arguing about soccer stuff. All right, so like I said, you're going to get a chance to look at their polygraph data. But first, we have to learn more about a polygraph and what it is. So in forensic investigations, polygraph tests, which are also known as a lie detector tests, if you've heard of lie detector tests, that's what we're talking about. These are sometimes used to help determine the truthfulness of someone's testimony. Now, importantly, polygraph tests are not 100% reliable in detecting lies. Okay. When we see changes in a polygraph test, those indicate that somebody might be lying. The reasons for that are because when somebody lies, they have changes in their physiological responses. Usually. Not always. Some people are really good liars, and so some people can lie and not have any physiological responses. Likewise, you can also have a lot of false positives. People can have changes in their physiological responses due to other factors that might not be them lying, right? Think about anybody who's being interviewed here, right? If they're being asked questions about their dead friend, right? That can cause an emotional response. Emotional responses, other than lying, can also cause changes in physiological responses. So keep that in mind. There's going to be an ethical scenario that you look into later all about the admissibility of polygraph tests in court. So what is a polygraph test? Well, the prefix poly means multiple, right? That is a prefix meaning multiple or many. And so we are graphing many physiological responses. So those physiological responses that are usually included in a polygraph test are heart rate, blood pressure, respiration rate, and skin conductivity. Heart rate, of course, is just number of cardiac cycles per minute, usually registered in beats per minute. Blood pressure, this is measured in millimeters of mercury, and we're going to talk a lot more about that in a future unit. Blood pressure is just the pressure that is exerted by the blood on the walls of the blood vessels. Respiration rate, how many breaths per minute somebody is taking, right? How frequently, how quickly they're breathing. And then skin conductivity, this is something that is measured that is used as a proxy for or an approximation of the amount that somebody's sweating. When somebody sweats, it interferes with their skin's ability to conduct electricity. And so changes in skin conductivity could indicate somebody's sweating, and sweating is also possibly an indication somebody might be lying. Because when people lie, they get stressed out and they might start sweating. So it's a little bit of a preview there of polygraph tests and physiological data.